Hello, welcome back to the sqadia.com, the best medical learning platform all over the world. So today, the topic we are going to discuss is about hoarseness. So you might be thinking, what is hoarseness? Like you probably have heard this term several times, but today we are going to, classify it into a more precise way. So dysphonia, which refers to having an abnormal voice, is called hoarseness. The changes to the voice can occur suddenly or gradually over time. The voice can be described as rough, raspy, strained, weak, breathy, or gravelly. Most commonly, dysphonia is caused by an abnormality with the vocal cords, but there can be other problems as well, like the problems including airflow from the lungs or abnormalities with the structures of the throat near the vocal cords. Now, you must be thinking what normally a patient feels like. Patient normally complains of a dry, scratchy voice. The most common cause of hoarseness that has lasted less than 2 weeks is inflammation in the voice box, often accompanied by a cold and a sore throat. So let's dive deep in and explore further. Question number 1. To start the questionnaire session and to make learning easy for you, sqadia has an easy mnemonic. So you can remember these questions on your fingertips. If patient overused his voice, any pain while talking, exposure to cold weather or dust recently, neck swelling to rule out goiter, also investigate for cerebral vascular accident or CVA history that includes TIA or stroke, ask for heartburn to rule out GERD, then ask for any infection like upper respiratory infection, pharyngitis or HIV. Lastly, you can ask if patient is experiencing any sort of night sweats, fever, chills, or difficulty breathing. Secondly, you should inquire patient if he or anyone in his family has had any of these conditions like chronic disease or alcoholism. Question number 3, you should ask patient if he smokes cigarettes, drink alcohol, or sing professionally. Question number 4. Now, one more important question you need to ask is about his medication history. If your patient is taking any medications, well, this is because this particular condition might be the result of adverse drug reactions to any of the drug. Now that you're aware of the symptoms of your patient, your main role starts here. Because you need to examine the patient, well, this physical examination includes temperature, examination of the back of the throat by using an instrument, check the movement of the vocal cords, thorough neck exam, look at the skin, check patient's reflexes. Now, let's see what can cause hoarseness and what is typical for each cause. Well, there are 7 different causes of hoarseness that you should be clear about. Laryngitis, puberty, chronic inflammation of the larynx, epiglottitis, laryngeal nerve paralysis, hypothyroidism, tumor of the vocal cord. I'll be explaining these terms in a while. Now, if the patient shows symptoms like runny nose, sore throat, facial pain, general malaise, then this might give you an indication that the patient has laryngitis, hoarseness that lasts less than 2 weeks. Well, laryngitis is the inflammation in the voice box. But if your patient has typical symptoms like voice change that mostly occurs in males, then this indicates puberty. Well, puberty is a period of becoming sexually mature or capable of reproducing. If your patient is having husky voice lasting years, that is more common in people who smoke cigarettes and drink alcohol, this indicates chronic inflammation of the larynx. It is actually the chronic inflammation of vocal cords. If the patient experiences trouble breathing, drooling, sore throat, noisy breathing that occurs in the children, particularly between the age of 3 and 7 years, then it indicates epiglottitis. Well, it is the inflammation of the structure in the throat that can block air passages. If your patient is having progressive hoarseness, weight loss, and cough, then this indicates laryngeal nerve paralysis. It is the loss of function in the nerve that supplies the voice box. If your patient is experiencing progressive hoarseness, thickened skin, coarse hair, intolerance to cold, then this indicates hypothyroidism. It is the decreased activity in the thyroid gland which regulates metabolism. Lastly, if your patient is experiencing progressive hoarseness, which is more common in people who smoke cigarettes and drink alcohol, then this indicates the tumor of the vocal cord. It is unchecked abnormal growth of cells in the vocal cord. So now, if you're clear about your findings, you can manage your patient accordingly or do further investigations if required. So that was all about the differential diagnosis of the hoarseness. Stay tuned to the sqadia.com for more such knowledge-stuffed videos. Bye-bye.